With this PowerPoint, we will cover the Mucorales, which is in Chapter 59, pages 782 through 786. And I do have the e-version, so these may be slightly different, but they should be pretty close. So we will be looking at the order of the Mucorales and the Entomorphorales. Now, this one is a little questionable right now of whether it's its own phylum, but I'm going to include it in the Mucorales lesson, and we will cover these two organisms here. So the Mucorales was once referred to as the Zygomycetes, and so these are the ones that we will be taking a look at, or at least some of them, the ones that are highlighted is the ones that we will focus more on. So with the Mucorales, we will identify them microscopically based on several of these characteristics. So you should go ahead and be familiar with this terminology. So to start off with, their hyphae are very ribbon-like. So you can see up here where these look like a lot of ribbon just kind of folded around in there. When we look at the structure of the fungi as how it appears on a plate, what we are looking for is the sporangia. So that is the plural form of sporangium, which is a sac-like fruiting structure. So inside of it is sort of like little seeds or sporangiopores. So you can see several of those inside of this sporangium. The sporangiophore is the stalk, basically. So this structure here that holds it up. The stolons, or not quite roots, but you see those here, sort of like hyphae. The rhizoids, or the root-like structure. So you see those here at the bottom. And depending on where their placement is along the stolon, it helps us to determine the species of the organisms. The columella is right here, which is this structure that comes out of the sporangiophore. So it's what basically this whole sporangium forms around. And the collaretta is sort of like a little collar, so you can see that structure sticking off here. And the apiasis, there's not a picture depicted here, but when you have, here it is. So this part right here at the end will swell for some organisms. So you will look for this swelling to happen versus it just being straight. The Mucorales have a worldwide distribution. They are found on decaying organic matter, bread, and in the soil. So infections are acquired through inhaling the spores, or you could obtain it through some sort of percutaneous route, like a scratch or something, or you could ingest them. Your specimens would be something like deep tissue lesions, the deep tissue or the actual lesion itself, nasal discharge, sinus scrapings, aspirates, vascularized tissue, sputum, bronchial lavage, the lung tissue, or biopsy material. And of course, all these need to be collected with an aseptic technique just to prevent any sort of contamination, cross-contamination. Since you can't find these regularly throughout the environment, it needs to be collected in something without formalin, because the formalin can actually destroy these. And it needs to be transported to the lab pretty quickly and processed, because these are very sensitive to environmental changes. The treatment of these is very difficult. Mucormycosis is the infection caused by the mucorales. And so patients who get this are typically more at risk if they're immunocompromised. So this could be something like prolonged drug therapy, uncontrolled diabetes, any sort of like immunosuppression. So some of the diseases that it causes is a vascular invasion. It could cause some sort of tissue thrombosis or necrosis, and you can see that here in this image where the tissue surrounding the injury is starting to decay a little bit. Lung infections, GI infections, and diagnosis is based on direct examination, or it can be based on the nucleic acid testing, PCR testing, or recovery of the actual fungus itself through culture. So these cultures, they do grow very rapidly. So the mycelium do develop very quickly within about 24 to 48 hours. So these are actually referred to as lid lifters because they grow so fast that they start actually raising the lid. So fungal cultures actually get a seal around them. That way, number one, it kind of holds them tight, but number two, it also prevents any of these spores from leaching out from around the edge of the culture lid. So they do appear very fluffy. They can be white to gray to brown, kind of like a cotton candy type look where they're just so fluffy. And they just basically just cover the entire agar plate. The hyphae can be kind of grayish, but they are also sort of dotted with some dark sporangia. And the morphology doesn't differentiate a whole lot between these, and since you don't really need to know much about the morphology of them, then we won't really focus on that much for this lesson. So let's look at the microscopic identification of the Cunninghamella species. So the hyphae themselves are very broad, so you can see where they're real wide based on this picture here. And you can see that ribbon-like structure. These sporangiophores are long and branched, so you can see how long this one is here as it comes up. And then with the branches, they tend to be real short, and they come straight off that sporangiophore. Each of those terminates in a swollen vesicle. So you can see down here where that little swollen vesicle comes off that sporangiophore. And you may also remember that I've termed this with the apoporus, and you can see off of each of those in this picture here where they have little spikes on them. So is where those sporangiopores actually connect to. So you can see a lot of those on these images where they're still attached, but then you have those little prickly things coming off of it. And if you look real close at this image, you can see some of those there as well. So this is kind of the classic look of the Cunninghamella, and it differs a lot from the species that we're going to look at here coming up. So Rhizopus species also have a very broad aseptate hyphae, so you can see how broad these are up here, up top, and you don't see any sort of little divisions inside of those. They are also unbranched, so you don't see any small branches coming off of them with anything else connected to them. So don't confuse what's happening here as a branch. They are all coming straight out of the rhizoids here at the bottom. So those rhizoids, the sporangium, what you're looking for Rhizopus is that the sporangium, or sporangia for singular, plural, are all coming straight over top of these roots of these rhizoids. You can see this image over here that they're doing the same thing. They come straight out of it. And so you're looking for the sporangium, or sporangia for plural, right over top of this root-like structure. And so that's what's going to be characteristic of the Rhizopus. The rhizomucor also are very broad and aseptate in their hyphae, so no divisions. The sporangiophores are branched. You can see up here in the top corner how you have the very long sporangiophores, but then you also have some short ones coming off of it. So this one here is very long, but then it has some little branches coming off, and the branches themselves are shorter. The rhizoids are sort of offset from the sporangiophores, so you can see this root here is not directly under where the sporangiophore rises, so it's offset to the side a little bit. So sometimes you'll see them in between other sporangiophores that would come up. The Mucor species have broad hyphae as well, and they are aseptate, but you can see an occasional one. The sporangiophores are located within the sporangia, or the sporangium, and you can see those here where this one has kind of popped open. So these are what would get airborne and be distributed throughout the environment. The sporangiophores are very long, and they do branch, so you can see the short branch here, which ends in the very round sporangium. There are no rhizoids or stolons. Leishthemia species also have broad aseptate hyphae. These sporangiophores rise in groups of 2 to 5, and they are branched as well. The sporangia is a pear-shaped, so you can see here up top in the center where it has that pear shape, and then it also has this swelling here, so you can see the swelling right here, the apipias. It also has rhizoids that are along the stolon that are offset from the sporangium. So you can see here in this image to the side where they are on the side of and not directly under the sporangiophores. When comparing the mucor with the Leishthemia, the mucor does not have that swelling at the end of the sporangiophore. So you can see here in these two pictures where it just runs straight up until it hits the columella, whereas the Leishthemia has that swelling. The Mucorales are found in soil, decaying vegetable material, and animal feces. They are also found worldwide in warmer climates. Enteromorphomacosis infections primarily affect the immunocompetent individuals. Basidiobulomycosis causes subcutaneous tissues of the arms, legs, buttocks, trunk with woody, hard, painless nodules. The Candidiobolus species infect tissue around the nose and on the face, and this happens after inhaling the spores. So you can see an example of that here, where you have all of that swelling in the face around the nose. Entomorphoralis may be diagnosed based on a direct detection method where the tissue itself is examined for the splendor Hofali phenomenon, which is where you get this little eosinophilic type appearance around the edges, where you have these little crystals around the edges that gives it sort of a star-like or asteroid type look. So you see that pink eosinophilic color. PCR can be used for Basidiobulus, and you can also do culture, but when you do culture, of course, you would have to take the tissue and slice it or mince it and put it on potato dextrose or Sav agar. 2 cultures should be performed, one at 37 degrees for the Candidiobolus and one at 25 to 30 degrees for the Basidiobulus. So you would take the same specimen and culture it on 2 different plates, so the same type of plate, but you would just culture it twice so that you could incubate at 2 separate temperatures. So the Basidiobulus morphology, it is macroscopically a fast grower. The colonies appear slightly yellow to buff with radial folds. So you can see that here in this image at the bottom where you have all of those little folds going out. Flat, no aerial hyphae, so it's not fluffy, it's not sticking up with all that aerial hyphae. With age, it can kind of start to be heaped and have a powdery type substance on it. And what can happen with these is the conidia can be ejected very forcefully, and so it can pop out and start forming all of these little satellite colonies down here. If you're looking at it under the microscope, they are large septate hyphae, so you can see some of those hyphae here at the bottom. And they have numerous zygospores with these little areas here. So if you look at this top image, you can see how these zygospores kind of pouch out just a little bit. They are can have that little piriform or funnel type appearance to them. Conidiobolus appear on a plate as a fast-growing mold. The colonies can be a cream color, but as they start out, they are initially kind of waxy, but then they can come powdery. So you can see that here up top. And then sometimes those conidia can cover the lid from where they pop open. So the lid can kind of get a little haze to it, or it can appear as though something's growing on the lid. When we look at it under the microscope, the primary conidia have these little projections on them. So if you look here at the bottom, you can see several of them that have little small projections around the edge. And then as the colony ages, they start getting these more hair-like spines, so you can see those poking out a little bit more as it gets a little older.